Life Unrehearsed, brought to you by Lianas Senior Transition Support, helping you navigate home care and senior residences.
Good afternoon. Welcome to Life Unrehearsed. I'm Matt Del Vecchio, specializing in life transitions, downsizing, and the senior living industry. Coming up on the first half of Life Unrehearsed, can you imagine being in a situation where you were diagnosed with cancer and you can't get treated? The pandemic pushed back waiting times for cancer surgery, but is the situation improving? We're going to hear more about this, as well as a focus on skin cancer, as May is Skin Cancer Awareness Month. And on the second half of the show, we're all aging a bit more, and as we age, our risk for falls increases. A lot of that is due to our aging bodies and maybe not doing the proper exercises. And a lot of it is actually quite psychological. In fact, just the fear of falling can have a greater impact on falls. Well, we're going to have medical expert Dr. José Moret on with us to talk more about it. That will be after the 4:30 news. I'd like to mention an upcoming event being held by Myra's Kids Foundation. This is an incredible organization supporting families and especially children and young adults that have had a loved one that passed away. They have a wonderful summer camp, and their annual fundraiser called Ignite is just around the corner. In fact, it's this coming Wednesday, May 24th, and the fundraiser will be held at the beautiful Jardin Royal starting at 6 p.m. So you can find out more about that at myraskids.ca. That's MYRAS kids.ca. myraskids.ca. Such a great cause. All right. Now, did you know that cancer still remains the leading cause of death in Canada? And an estimated 2 in 5 Canadians will be diagnosed with cancer in their lifetime, and about 1 in 4 will die from cancer. So can you imagine the stress and anxiety of being diagnosed with cancer and not knowing when you're even going to be treated? And what if you had just finished up your treatments and you still can't find out if you are cancer-free? It has been extremely stressful for some cancer patients. Well, at least there are some groups and individuals that are fighting for us. And to tell us more, we have Eva Villalba in studio with me. Eva is the executive director of the Quebec Cancer Coalition. Eva has been involved in healthcare charities, advocacy groups, and nonprofits throughout her career. Eva, welcome to Life Unrehearsed.
Thanks for having me, Matt.
Well, thank you for coming into studio here. You do such good advocacy for all of us here in Quebec. So for listeners that may not know, what is the Quebec Cancer Coalition?
The Quebec Cancer Coalition is a coalition of over 65 nonprofits in oncology, representing all forms of cancer, all regions of Quebec, all phases of the cancer journey as well.
All right. And so obviously, we've all heard about Bill 15, the health reform. I'd love to hear your take on it. What are you seeing there from a cancer perspective?
So the health reform talks a lot about decentralizing and bringing care closer to communities. So that in itself sounds really good. And on paper, it seems nice. It seems like we're not only going to improve the efficiency and performance of the healthcare system to respond to the needs of populations, but we're also going to be more transparent with data. So that seems good on paper. However, there's one thing that's really lacking that concerns us, and that's there's no mention of cancer at all in any of the 300 pages of the healthcare reform bill. And that's really concerning, especially considering that other provinces have dedicated cancer plans, cancer agencies. And so that's really what we would like to see here in Quebec is a dedicated cancer plan like they have in places like France or even in other places in Canada like BC. Even PEI has a 10-year cancer plan.
So you're saying there's 10-year plans, there's these agencies in other provinces, and like you say in France, nice benchmarks for us, but we don't have that here in Quebec?
Exactly. And we want very measurable things. Last year in May, we had a general estates on like cancer control to say, okay, if we did have a 10-year cancer plan, what should that include? And it includes measurable objectives, transparent objectives. We see all these dashboards that the Ministry of Health is now having, and we applaud that transparency, and that's great. But we would like to see one dedicated for cancer, using such indicators like reducing preventable cancers, of which skin cancer is one that we can attack very quickly, improving the prognosis or the mortality rate of certain cancers that have been totally ignored, like pancreatic cancer or upper GI cancers, rare forms of cancers, not the top 4 that we usually hear about. We have been making strides in those. For example, the rate of mortality for breast cancer has dramatically gone down, and that's amazing. But now can we pay attention to the other cancers as well? And I think that's something that we need to actually have a prioritization on that we haven't yet. And we're concerned that in this reform, we're going to actually lose the little that we have so far, which is a Quebec Cancer Program. It's not even an agency or an institute like they have in France. And so that's what we would like. We would like some clear, measurable objectives to make sure that we're going in the right direction and that we're not flying the airplane blind, which is kind of what we're doing today.
Listening to Life Unrehearsed, Matt Del Vecchio here, and I'm talking to Eva Villalba. She's the executive director of the Quebec Cancer Coalition, fighting for our rights, certainly when it's related to cancer. Now, Eva, you were on this show almost 3 years ago to the day. Now, this is May 2020, and we are in the thick of the pandemic, and it was, I can't imagine what you were going through because you're fighting and advocating for people's rights. And we know at the time, everything was put on hold, and it must have been incredibly stressful and anxious for families, individuals that are waiting to get their cancer treatments. And I'd like to think, Eva, that things have improved. Let's put the clock 3 years forward to today. Are cancer treatment times and waiting times improving?
So the good news is that when it comes to treatment, Quebec actually responded much better than the rest of Canada. So we had less delays than everywhere else. So for treatment, there were a lot of adaptations done during COVID, so that was pretty good. However, for surgery wait times, and we heard a lot about it in the news, that was a serious problem. And we had these huge backlogs for surgeries. So there's good news and bad news. The good news is that for surgery, oncology surgery, it has gone down. So there was really a concern over oncology surgeries that were taking more than 2 months. Some cancers can wait 2 months, some can't. We were also concerned that wasn't being communicated to people. So if you have a slow growing prostate cancer, that can wait 2 months and it's okay, but not 3, right? And so there was a lot of kind of miscommunication with the public, and that was a problem. So today, those wait times have been improved. So there's very few people all across Quebec waiting more than 2 months for cancer surgery. That's amazing. However, surprisingly, the people that are waiting for all kinds of surgeries, so I know that your listeners, have all kinds of health problems, that has actually increased, even compared to last year. And that's surprising because the government actually very methodically had some special contracts with private hospitals in order to make those surgery times go down. And so we see that at least for oncology, that has really worked. But for other surgeries, such as those that might concern your audience, like hip and knee replacements and other semi-urgent surgeries, that has actually gone up, and that's really a problem. And so now they have like a 3-year plan to make that go down. But as of today, those numbers are over 17,000 people in Quebec that are waiting for surgeries for over a year. So that's problematic. But luckily in oncology, we see that there has been a concerted effort to address that, and it really does improve the quality of life and the prognosis of people, how long they will live, because we are prioritizing that.
Yeah, like you say, it's silver lining. If the priority needs to be somewhere, it would be on oncology. So that's nice to hear. But could you imagine what you just said? 17,000 people waiting for over a year, and that's not not improving. I'd like to get into some. You guys work so hard at the Quebec Cancer Coalition, advocating, lobbying for us. What are some of the recommendations that you're doing these days?
So these days we're talking a lot about, for example, improving access to clinical trials. That was totally halted during the pandemic, and that was a real problem. We're talking about accessing biomarker testing or like more precision oncology. So giving the right treatment to the right time and to the right person, and not necessarily giving the same thing to everyone and hoping that they'll survive and then giving them, second best chance, third best chance. So that's really a problem. And elsewhere in the world, they're actually targeting it more. And so that's one thing that we would really like. We're also talking a lot about giving people, patients, survivors, families, the tools that they need, the information that they need to be partners in their own care, to really make informed decisions on their care. And there's some movement in that. We see like an improvement in the culture and the shift. We've also been advocating a lot for a more value-based approach to healthcare, which means actually measuring that people's health is doing better. Currently, we're just making decisions based on how much things cost, So we want to make sure that we're measuring things like patient experience and patient outcomes.
We're talking with Eva Villalba. She's the executive director of the Quebec Cancer Coalition. And as you're hearing, a real great voice for us Quebecers. Very quickly, before we head out to traffic, if you were to say, what's the number one thing that cancer patients want?
I think it's reassurance that they're being well taken care of and that they have the information that they need to make decisions and to be empowered to be partners of their own care.
In listening to you, and you're doing surveys to get that reaction, I wouldn't have thought that, but it makes perfect sense what you're saying. That, could you imagine, being diagnosed? It's happened to many people here in Quebec, and there's the extension of the families and loved ones that are worried. And if you get that reassurance, if you get that knowledge, I think that will just calm the waters a little bit, despite the fact that you still have to deal with this terrible disease. Well, excellent points you're bringing up, Eva. We do have to head out to traffic, but you've mentioned something very important. May is the month of Skin Cancer Awareness Month, and this goes hand in hand with the Quebec Cancer Coalition. So we're going to focus a little bit more on skin cancer, talk about some stats and if things are improving there and what we can do to prevent it in a wonderful documentary that we're going to talk about. Welcome back to Life Unrehearsed. Matt Delvecchio here, and I'm talking to Eva Villalba, Executive Director of the Quebec Cancer Coalition. And as you heard, the waiting is improving a little bit on cancer treatments, not so much on the standard, hip operations, knee operations. That still has a lot of work to do. But as we heard just before traffic, we were talking about May being Skin Cancer Awareness Month, and Eva is very much involved in advocating for that. So let's start, Eva, with how prevalent is skin cancer in Canada?
So surprisingly, over 80,000 people are diagnosed with skin cancer every year in Canada, and yet we hear very little about it. 1 in 3 cancers detected worldwide are skin cancer, and yet we hear very little about it. The reason is because there's actually a very good survival rate if you catch it early, and it's easy if you know what to look for. And so there is like a 99% 5-year survival if caught early. The problem is when it's not caught early, right? But the other really preoccupying thing is that the mortality and incidence has actually doubled in Quebec specifically, but everywhere in the world as well, in the past 20 years. And if you were born in 1990, you actually have 2 to 3 times more risk of developing skin cancer than if you were born in the 60s. And one of the reasons is because of tanning beds. Tanning beds are terrible. They're actually banned in Brazil and Australia. And if you've been exposed to tanning beds before the age of 30, your risk of getting skin cancer increases by 60 to 70%. So this is a totally avoidable cancer. It's a very prevalent cancer, but there's so many things. The good news is there's so many things that we can do to actually avoid it.
Yeah, and we're going to talk about some of these prevention techniques. It's amazing just listening to the statistics. And you mentioned the top 4 cancers before. It's assumed that, okay, well, skin cancer is not on that list and it's by far the number 1 cancer in Canada. And so we want to address that. And I'm glad there's, attention being put in the month of May as we head into the summer months, because it's far beyond just tanning beds. That's certainly one avoidable one. So let's talk about some of the prevention tips for skin cancer that we can use.
Absolutely. So first, before talking about prevention, you have to talk about the risk factors, right? So the first risk factor is your complexion. So if you have light complexion, a lot of people, the society tells us that we should be dark, and there's this whole lifestyle that we should be much darker, which leads us to over tan. But people that have light skin are more predisposed to burning, and burning leads to skin cancer. So your complexion is one, the number of moles you have, tanning bed use, it's zero added value. There's no need for tanning beds. And there's a misconception too that because we live in a cold country, the sun is not as warm, so we really got to suck it up while we can. But that's actually a misconception, because after 20 minutes, you can totally burn. And especially for young kids, if you get 5 to 6 burns when you're a child, that increases your chances of having skin cancer by 60 to 70%. And then finally, family history. So the way you can prevent it is by covering up. So being in the shade, using UV protective clothing, and limiting your time in the sun, and obviously wearing sunscreen. So those are the ways and it's so easy, it's so accessible to us. And just by doing that, you can actually prevent yourself and your family from getting skin cancer.
That's Eva Villalba, Executive Director of the Quebec Cancer Coalition. May is Skin Cancer Awareness Month. Just quick, you talk about complexion of the skin. I'm Italian, you're Spanish. Our next guest, Dr. More, is Portuguese, and we maybe, I know I find myself guilty. Oh, okay, maybe we have a bit of a darker complexion. We can cheat a little bit or get more exposure to sun. probably not the right attitude, right?
Exactly. So it's actually a misconception that even people of color will not get skin cancer. That is not true. For sure, it'll take them longer to burn, but everybody can actually burn. And I'm sure you've had burns. I'm sure we've all had burns. And so it's really a question of always protecting yourself, not taking it for granted that you have dark skin, so you're protected, and seeking the shade, especially when you're doing sports or outside, and not forgetting about protecting our children who are way more at risk.
Really good points. All right. Now, there is a documentary coming up called Doc UV. Okay, I love the name of that. It's I think it's coming out on May 29th. Can you tell us a little bit more about this?
Absolutely. So it was actually an initiative brought to us by a patient, a woman who had had 2 skin cancers before the age of 40. And it was really caused by an overuse of tanning beds before the age of 25. So she had her first cancer at 24, 25, and her second one at 39. The second one was quite scary, and there's no reason that people should have advanced stage melanoma for a cancer that should be avoidable. So she decided to do something about it, interview experts, and she put together this amazing documentary that our coalition is supporting, and we're launching it on May 29th at the SAT in Montreal on Saint Laurent and St. Catherine. And it's really all about the dangers of UV exposure, what we can do about it, and actually mobilizing communities at the municipal, provincial, and federal level to do something about it, and raising that awareness with families and even children, and making sure that we do very concrete actions to reduce this very avoidable cancer.
Now, so that's coming up. Can't wait to hear more about that. We'll at the end we'll just give a link to that site. Now, just as I'm listening to you, and I hear, okay, what if I don't have a dermatologist?
Yeah.
Okay, I might have a GP, and that's an issue in itself, right? A million Quebecers without a GP. But so what do we do? Let's say you see something and you're worried, but you don't have a dermatologist. What do you do?
So there's actually excellent resources online. One of our member organizations is called the Save Your Skin Foundation. So that's they have some excellent information online in order to detect, does this mole look odd, and what are the signs to look out for? And then now you can either see your GP, or they're expanding to family practice groups. So you might see a nurse, or so you can actually detect yourself and your children and your family, and seek out care, not just from a family doctor if you don't have one, but there's other access points now. So that's definitely what we suggest.
And can you repeat that if someone wants to look up Save?
Yes, it's called Save Your Skin Foundation. So saveyourskin.ca is it's easy to remember, and they do great work. They have a lot of amazing information about skin cancer and skin cancer prevention.
Great. All right. I want to go back to that documentary. It's coming out on May 29th.
Yes.
And it's being held where? Did you say SAT?
At the Société d'Art Technologique, which is on Saint Laurent and St. Catherine in Montreal. It'll be at from 5 to 7, more or less. We're doing our preview screening, the first time ever that we're showing this. We're very excited about it, and it's just the beginning of our awareness campaign. So if people want to support us, if people want to come out and see it, we would really appreciate it. And they can actually get tickets at docuv.eventbrite.ca.
So that's docuv.eventbrite.ca.
That's right.
Okay, sure. Well, Eva, thank you very much for coming into the studio here on a Sunday. Really appreciate it. And we wish you much success fighting for us Quebecers when it comes related to cancer. Thank you so much for all your hard work.
Thanks for having me.
All right, thank you. That's Eva Villalba. She's the Executive Director of the Quebec Cancer Coalition. Next up on Life Unrehearsed, as we age, our risk for falls increases. And a lot of that is due to our aging bodies and maybe not doing the proper exercises. And a lot of it is actually quite psychological. In fact, just the fear of falling can have a greater impact on falls, believe it or not. Think about that one.